Cleaning your nipples before pumping breast milk is an important step that many new mothers overlook. While it might seem like a small detail, ensuring proper hygiene before expressing milk helps protect your baby from harmful bacteria and reduces the chances of infections like mastitis. It also helps maintain the cleanliness of your pump parts and ensures that your milk stays as safe and healthy as possible for your baby. So let's talk about how to do it the right way. Gently, effectively, and without overcomplicating things. Start by washing your hands thoroughly. This is the very first and most essential step. Use soap and warm water, scrub for at least 20 seconds, and dry your hands with a clean towel or allow them to air dry. Clean hands mean you're not transferring germs from your skin to your breasts or to your pump equipment. It's a small habit that makes a big difference. Now let's talk about your nipples. You don't need any fancy soaps or special wipes. In fact, using harsh soaps or alcohol-based products can dry out or irritate the sensitive skin around your nipples and areolas. Warm water is usually enough. You can soak a soft washcloth in warm water and gently wipe the entire breast area, focusing on the nipple and the surrounding skin. This helps remove sweat, milk residue, or any bacteria that might be lingering on the skin. If you haven't showered that day or you've been sweating, you might want to clean more thoroughly. In that case, use a mild, fragrance-free soap, something safe for sensitive skin. Lather it up gently on your fingertips, apply it to your breasts, then rinse thoroughly with warm water to ensure no soap residue is left behind. Residue can irritate your baby's mouth or cause skin problems on your breast if not rinsed properly. Be careful not to scrub or rub the nipples too hard. The skin there is already under a lot of stress, especially if you're breastfeeding in addition to pumping. Over-cleaning or using rough materials can lead to cracking or soreness, which can make pumping painful and decrease your milk flow over time. Always pat your breasts dry with a clean towel. Avoid rubbing, and definitely don't use shared or reused cloths, as they can carry bacteria or fungi. If you're in a hurry or not at home, consider using a clean, warm, damp cotton pad or a gentle baby wipe that is alcohol-free and unscented. These are better alternatives than skipping cleaning altogether, especially if you've been outside or your skin feels sticky. But remember, these options are for occasional use. Regular warm water and a soft cloth are still the best daily approach. Some mothers wonder if they need to sterilize their nipples like they do with bottle parts. The answer is no. Your body is naturally equipped to protect your breasts and your baby. Sterilization of the skin is not necessary and can actually do more harm than good. All you need is basic hygiene and a consistent routine. In fact, cleaning too aggressively can strip away natural oils that protect your skin. Also, take note of how your nipples look during the cleaning process. If you notice any cracks, soreness, redness, or unusual discharge, it might be time to speak to a healthcare provider. These symptoms can sometimes be signs of infection or improper latching if you're also nursing. Cleanliness is important, but paying attention to your body is equally vital. After cleaning your nipples and before starting the pump, make sure all your pumping equipment is clean and assembled properly. Always wash and sterilize pump parts as recommended. Dirty equipment can cancel out all the effort you put into personal hygiene. Being consistent with your nipple cleaning routine helps protect both you and your baby, keeps your milk supply healthy, and makes the pumping experience more comfortable. It only takes a few minutes, but those few minutes can make a big difference in your breastfeeding journey. Think of it as a loving habit, not just a hygiene step, but something you're doing for both your comfort and your baby's safety.